Hi. We've learned a lot in the last couple of years about HIV prevention and specifically talking about treatment. I'm Kay Hayes here with HIV.gov here at the 2018 National Ryan White Conference, HIV Care and Treatment. And I'm delighted to have two colleagues here, Dr. Laura Cheever, who leads our Ryan White program, and Harold Phillips, who's a division lead for training and training capacity development, more specifically. So, more specifically, let's get to the basics. Let's talk about what's happening. Let's get down to the nitty-gritty and talk about some of the messaging and things that have been happening. I really want to focus on, in the recent years, about prevention benefit of HIV treatment. And we've heard about it here at this conference. And so more specifically, I'd like to hear your take on what's happening and how we share those messages, and what is the message that we're talking about to our family here listening in.
So I guess I'll start.
Great.
So in the past few years, we've had several studies that have shown that in thousands of couples, either male and male couples or male and female couples, where one partner is HIV positive and one partner is HIV negative, that there's effectively no risk of transmission of HIV if the HIV partner is on their HIV medication and is virally suppressed. What that means is that person is taking their HIV medication every day as directed. They're getting their viral load measured at their doctor's office through a blood test. And when they can really demonstrate that their viral load is undetectable, now they're not cured, they still have HIV in their body, but it's not circulating because the medications are working well, that they are not going to transmit HIV sexually to a partner. That means whether you're having oral sex, anal sex, vaginal sex, you're not going to transmit HIV sexually, which is a huge advance for us and very exciting. We call that treatment as prevention, or TASP. And it really has changed the way we look at HIV transmission. And it really underlines the importance of taking medications as directed. We've known for a long time that people with HIV who take their medications as directed will live a near normal lifespan. So it's incredibly important that people with HIV get tested, get linked to care, and get put on treatment, and that they take their treatment right every day. So it's important for the person, and now we know it's also important in terms of ending the epidemic in this country.
That's exciting news. And I know everyone listening in, this has been a part of a conversation and a huge leap as we move forward in HIV prevention. So now that we've talked about just a little bit, I know there's been an effort within the federal government that we have these discussions and that there's a consistent message. And that's critical, because one thing about messages, we all need to be on the same page. And to do that, there was a lot of work that was involved. A lot of people came to the table. A lot of people, as you say, were present in the moment and spoke their truth, and we listened to that, and that's important. So what was it like in talking about that sort of federal, if you will, interagency work and how we got to that process? Because it wasn't an easy process, but we got to that process, and that's the important thing.
No, I'll take that one. It was a very involved process that involved a number of federal agencies really coming together, and like you said, Kay, also listening to the community about how can we put this message out so that it's meaningful and that it's received and that people understand it. So it involved both policymakers and scientists and government officials and community really working together around the messaging. And I think we finally did come to a consensus. And the consensus message is that people living with HIV who take their antiretroviral medications as directed and achieve and maintain a suppressed viral load have effectively no risk of transmitting HIV sexually to an HIV negative partner. Right. That message is game changing, and like Dr. Cheever talked about, really important to our efforts at ending the epidemic.
Right. And I think what Harold just said, that's game changing. I mean, both Laura and Harold have talked about that, and I can't understate that, overstate it. I'll repeat it several times, because for me, messaging is you say it repeatedly, so everyone gets it on the same page. I know that on World AIDS Day, HRSA's been busy. You guys did a letter to your Ryan White partners, right?
Absolutely.
And talked about this, and that's where I talk about everyone being on the same page. Can you share a little bit about the letter and sort of what happened after that when you share that information?
Sure. So in putting out the letter to our recipients, over 3,000 partners who are providing HIV care and treatment across the U.S., and also part of HRSA's global work, we put out a letter to the PEPFAR community of the of the HAB grantees that we also fund through the President's Emergency Plan for AIDS relief. Really, that message was designed to get them to incorporate the viral suppressors messaging in part of their work. So training for healthcare workers, curriculum development for those who are in health professional schools, doctors and nurses being trained so that they have this information and know how to incorporate it into their work. We also included the messaging for people living with HIV because it's important that they get and they understand this message too. Because it has such an impact on self-worth and potential impact on stigma and discrimination. So HRSA included them as well as our planning bodies who are involved in both strategically planning the use of our resources and their efforts at providing care and treatment services in their community. So incorporating these messages around viral suppression are important to all of those different groups. So they were included in our letter that went out as part of World AIDS Day.
Yeah, and I think I would add to that there's also an important part of it around sexually transmitted infections. So people with HIV are not immune to sexually transmitted infections now that they're not transmitting their HIV virus.
Yes.
So issues around who you're having sex with and condom use that have existed for years continue to exist. And that's important because we have incredibly high rates of syphilis, particularly among people living with HIV.
Right. And that's critical. I also want to say, for those of you that might have just joined us, we're here at the 2018 Ryan White Conference. I'm Kay Hayes with HIV.gov, and I'm delighted to have colleagues Dr. Laura Cheever and Harold Phillips here. As we move on, we talked about that letter that you said went out to 3,000 partners, but then again on World AIDS Day, HRSA was right on it again and teed up something else. Talk to me a little bit about what happened with that message.
So on World AIDS Day, we again communicate with across the government, within our partners in government, and within and with our partners around the importance of the Ryan White program in being on care and treatment and being virally suppressed. And that in the long run, we need to make sure people have access to care and continuous access to care in order to achieve those outcomes.
Right. I also know here today that we've been hearing these sessions and that these have been discussions. What have you been hearing, and what's the information you've been sharing and hearing? Because it's always two ways. We share information and we like to listen and hear back. So what have you been sharing and what have you heard in some of the sessions about this message?
You want to start, Harold?
Sure. The message, what we've been sharing is the need to incorporate the messages into our work. The importance of the message around both ending the epidemic, and we've been hearing, I think, getting some good feedback about some efforts that have already been taking place at the community level. We've also been thanked by a number of recipients and grantees about how important that message was, and they were glad that HRSA and our other federal colleagues put the message out there. We just had a listening session with people living with HIV where they shared the importance of that message, and we're grateful that we were working to get it out to healthcare providers, but also pointed out that we still have some work to do around that.
Right. Yeah, people did discuss that we still do have big gaps here, that people living with HIV haven't heard this message, many of them yet, and medical providers sometimes are sort of giving mixed messages about it, when clearly we've got good data that show that you have effectively no risk of sexual transmission for someone that's virally suppressed. We also heard at the clinical conference, that we have as a part of this bigger conference, that for people taking care of young people, they are really anxious about this message because more than half of young people are not virally suppressed. So we need to make sure people understand the nuanced part of this message. You need to be on your medication and taking them. And if you went to Florida for 2 weeks and forgot your medicines, oops, and that happens, that you may not be virally suppressed anymore, so you may be able to transmit. So you really have to stay on it and be on your medication. So if you don't know what your viral load is and haven't had it checked, then you can't assume you're undetectable.
Right.
And I want to add, we have the heavy hitters here with me today, Dr. Cheever and Harold. So if you have questions, you want to, please respond back, and we can address some of those questions. I just want to make sure that you realize that you can ask questions as we move forward. One of the things I wanted to touch on, and I just kind of teed it up, is that we have Laura and Harold here. And Laura, as a physician, as a practicing physician at a clinic, Ryan White Clinic in Baltimore, share with the listeners here some of your experiences and what you've seen, and you've seen sort of the evolution Because I think that's an important message, that there is an evolution. But please share, because I think it's really important for our viewers to hear that.
Great. Well, thanks. I think the place I would like to start is that there is still a huge amount of stigma. Harold had just talked about it. People living with HIV in Baltimore, we've had an epidemic for many, many years, and we've had a lot of people infected, so there should be a fair amount of community knowledge. I still have patients who have been undetectable for 10 years that their families expect them to eat off of paper plates and to use bleach behind them in the bathroom if they've been in the bathroom. Really hugely stigmatizing behaviors. So we really need to make sure people understand this message.
That's right.
That people are not, certainly they're never, HIV is not transmittable through casual contact.
That's right.
And so if we can really get this message out that HIV is not, if you're undetectable, you're not going to transmit sexually, as well as you are never going to transmit more casually.
Right.
We need to make that happen. For a lot of my patients, this message is not about sex. This message is about who they are as a person.
Right.
And understanding who they are as a person, and some of that sort of self-stigmatization or stigmatization from the community that we really need to address.
Right. Thank you. And Harold, sharing, you've been in the field and the evolution, sharing what you've heard and seen from a personal perspective. I think it's always nice to hear sort of that personal perspective.
So for me, I think I really did sort of come to appreciate the value of this message by sitting in a meeting and hearing from nurses in San Francisco about when she delivered this message to people living with HIV. Some of them were so moved they cried, that they were touched by the fact that for the first time we were telling them that they were not infectious and that they could love and have relationships and get married and just being able to be open to the whole entire human experience once again. That it was just so meaningful, and that we really had a responsibility to get this message out to the public in ways that they could receive it and understand it.
Right. And what it might mean in the listening session we just had with people living with HIV, there was a woman who said, well, I'm going back to school and I really want to go into healthcare, but I know I can't because I'm HIV positive. And I'm like, what are you talking about? And this is a well-educated person who's here at this conference where she works in HIV every day. There's still so much misinformation, and this message will be part of helping people understand differently.
That's right. And I think it's important when we talk about that consensus message, Harold, how are you integrating that message in the work you do in sort of training and capacity development?
Sure. So part of our duties in the Office of Training and Capacity Development is to administer the AIDS Education and Training Centers program. And we are working with our regional and our national training centers to ensure that the viral suppression messaging is incorporated in trainings that they're giving at all different levels, and that we have materials and that our health literacy efforts also incorporate these messages as well. So that's ongoing conversation. Many of them have been doing it. I think as they received the letter, they've been challenged to think about new ways to incorporate it, but have been understanding both through this conference and other communications that it is now an important part of the work that we're doing.
That's right. So I always ask, and I know my viewers want to know, have I missed something? What else? What didn't I ask you? What is it, that burning message that we haven't discussed, or we discussed it and we want you to say it again? So if you think of something, what's the takeaway message? What is it that you want me and the viewers here to take away from our discussion here?
Well, I think the sort of core message is that people living with HIV who take their antiretroviral medications as directed and achieve and maintain a suppressed viral load have effectively no risk of transmitting HIV sexually to an HIV-negative partner. And I would say also that people living with HIV, hopefully they are getting this message, and hopefully they're telling other people. Because I think that this message can also help us with our efforts to increase testing and awareness of status, and also help link people to care. Because now this becomes a goal for us.
Yes.
And it's a goal that's achievable and that many people have achieved, but we still need many more people to get to that point of achieving and maintaining viral suppression, both to end the epidemic, but also to keep people healthy and help them live fuller lives.
Great.
Yeah, I think the final thing I would add is that if you're concerned you might have HIV, or you're living with HIV and not into medical care, you need to get into medical care. You need to get on medications. you can live a near normal lifespan. You can live a long, healthy life with HIV, and you can have effectively no risk of transmitting HIV to others.
So I'm glad I asked that question. That's perfect. That was perfect. Thank you. Well, to our viewers here, I want to say thank you for tuning in. I'm delighted to have the two heavy hitters here, Dr. Cheever, Harold Phillips. So it was a delight to ask these questions. I thank you for tuning in here at the 2018 Ryan White Conference on HIV Care and Treatment. HIV.gov will be here also later today, so tune back in. We have more to offer. And I want to say thank you for tuning in. Have a good one.
Thank you.
Thank you.